20 years ago, we showed that bone marrow transplantation with, using cells from a donor is able to arrest the cerebral disease, provided this procedure is performed at the early stage of the disease. But it is not always possible to make bone marrow transplantation because of the lack of donor of cord blood. And in addition, bone marrow transplantation is associated with significant risk, in particular in adults. So the idea was to use the own bone marrow cells of the patients and introduce a normal copy of the gene using a new vector therapy. Up to now, we have treated 2 boys who were candidates for bone marrow transplantation but without donor. And overall, we can say with confidence that more than 2 years after gene therapy, their brain disease has been arrested in an identical way as it could have been arrested following bone marrow transplantation. That is, the brain lesion have progressed a little bit after gene therapy, and it is the same after bone marrow transplantation. And roughly 14 months after gene therapy, the brain lesion has been arrested, and I am quite confident that it will be arrested for life now. It could not have been possible to do gene therapy in these 2 boys. The disease will have progressed markedly, and they will be now in a very severe condition with loss of vision, loss of all mental function, a loss of working in a late stage of the disease, and with a very high risk to die in a few months or, let's say, in a couple of years. The meaning for the LD family is that we can expect now and in a very near future that this gene therapy approach could be available for all patients who are candidates to bone marrow transplantation and who develop brain disease. Even first for those who have no matched donor, or perfectly matched cord blood. And this in particular concerns the adult, which lack very often donor because it is necessary to have a high number of cells. In addition, we cannot also anticipate more later that this gene therapy approach could become a primary therapy for all patients with cerebral disease, in particular in the adult, in whom the risk of bone marrow transplantation is very high, close to 30%. And even we have still to work on that. Later on, we think that patients who have only the spinal cord form of the disease, which is called adrenomyeloneuropathy, and which affect, as you know, adult male, but also heterozygous woman carrier, might also benefit from this therapy. It has been a long way. In fact, with my collaborator Nathalie Cartier, we started to work on this gene therapy program in the early 80s, specifically in 93. But at the end of the 90s, we moved to use a new therapy, new gene therapy vector, which is derived from HIV virus. And I must say that the Stop LD Foundation, and particularly Amber and Rachel Salzman, have played a pivotal role in the early 2000 in helping us to contact the right person in the US to make possible this trial, in particular to make the vector, and without their help, this would not have been possible, and I must thank them very much on the behalf of all LD patients.